Yeah,
And we are live, Senators.
okay, you can hit got it. All right, so good morning, everyone. This is Senate Health and Welfare. It is January 27th. And this morning, we're going to do a couple of things. We want to get an update from the Department of Health on the Substance Misuse Prevention Oversight and Advisory Council, which is a really important council in state government, especially for this committee. And then we'll move on from there to some Green Mountain Care Board information. So welcome, Department of Health, David and Nicole. Why don't you introduce yourselves for the record and then let us know if you have something on our webpage for us, and I'll let you take over.
All right, well, good morning. My name is David Englander. I'm the Senior Policy and Legal Advisor to the Department of Health, and I'm delighted to be with you. Just a few seconds of background for folks who have not been involved. For years, we've had a series of councils dealing with everything from prescription monitoring to the prescription of opioids to alcohol and drug use. And this is a relatively new council that was intended to consolidate all those councils. We didn't have, I think at one point there was literally 4 different councils with totals more than 80 people. And the idea of this council was you have one group of people who are thinking not only about all those things, but thinking about those issues through the lens of prevention, which is what we're all seeking to do in this part of the world, right? We try not to divide the world between prevention and treatment, but the focus of this council is really on prevention. And so with me today, and Nicole will introduce herself. And Nicole Rao Mitski is the Substance Misuse Prevention Manager, who's within DSU, and she's the person who has the most contact with the council itself. So I'll hand it off to Nicole.
You know, because I don't think, Nicole, you've been in our committee before, have you? So why don't we introduce ourselves for you, and then we'll let you go ahead. So there you go.
Senator Terry Williams from Rutland District. I live in Pulteney.
Senator Ginny Lyons. I chair the committee, and I am a representative from Chittenden Southeast and live in Williston.
Good morning, Dave Weeks, Senator representing Rutland County, and I live in Proctor.
Hi everyone, Martine LaRoque Ulick from Burlington, and I represent Chittenden Central.
Wonderful. Thank you all for that introduction.
One more.
I'm so sorry.
Oh, hi, sorry I'm late. I'm Ruth Hardy from the Addison District. Good morning.
Great, thank you.
There you go, now you're set.
Wonderful. Thank you all for having me this morning. As you mentioned, Senator Lyons, this is my first time both with you all and to talk about the council. So excited to have your ear this morning. As David said, my name is Nicole Rao Mitski. I'm the Substance Misuse Prevention Manager within the Department of Health in the Division of Substance Use Programs. I've been with the department and division for 7 years. Previous to this position, I was a program manager overseeing a variety of grants, prevention through treatment. So part of that reason was why I was so excited to see this council come together and to be able to be part of it and support their great work. I thought it might be helpful to start and expand upon David's explanation of how this council came to be. In 2019, as David had mentioned, this council was signed into law through Act 82, in which it did take the place of 4, but primarily 3 councils. So the 3 councils that this really took the work over from were the Vermont Tobacco Evaluation and Review Board, more commonly known as VTERB, the Vermont Alcohol and Drug Advisory Council, VADAC, as well as the Opioid Coordination Council, or the OCC. So the intention, as David mentioned, was really to become less substance specific and really thinking about prevention as a system and across all substances at risk of misuse. We do have representation across folks who have very specific focus on particular substances, but the intention is really to think more broadly about the system as a whole. We started meeting in October of that year, so the group was really excited to get up and running, and we've been meeting and working regularly since then. I wanted to highlight our 5 members of the executive committee and then talk a little bit just about the sectors that are represented through the rest of the council. It is still a fairly large council. We have 24 members who are very actively involved. Of those, we do have 5 executive committee members. This council is chaired by the Commissioner of the Department of Health or a designee. Dr. Levine is currently chair. The vice chair is Melanie Sheehan from Mount Escutney Health, working in community prevention, which is wonderful to have that perspective as the vice chair of this council. Our 3 other executive committee members are Secretary French from the Agency of Education, the Chief Prevention Officer, who I believe you had the a moment to speak with her last week, Monica Hutt. And our final executive committee member is Morning Fox from the Department of Public Safety. I highlight the executive committee because that really shows the great representation and variety of sectors that are represented in this council. So as David mentioned, that we don't like to separate our prevention, intervention, treatment, and recovery. This council focuses on prevention, but does have representation from all of those sectors, including law enforcement, criminal justice representation, recovery, both folks who have lived experience and who are in recovery, as well as family members of individuals in recovery. We have great representation from different portions of our prevention system within the state, doing that work at a community level, as well as education representation, in addition to Secretary French. So in total, as I mentioned, we have 24 current members. In legislation, you will see that there are about 23 sectors called out. There are some folks who have multiple roles within the council, given their background and experience. Early on, the council did decide that mental health and having mental health representation was really important. So in addition to what you will see in Act 82, the council did formally add an additional sector representation of mental health. We are currently recruiting for 2 of those positions, which is individuals doing work for recovery in a community setting, as well as the mental health representation. But we are actively looking for folks and we'll be appointing those individuals within the next few months is our hope. I now just want to take a moment or a minute to talk about the current priorities of this group. So they have 3 goals that they are working toward, which is to increase protective factors to prevent the misuse of substances, to work toward decreasing risk factors, again, for preventing use or misuse of substances. And their third goal is really to look at the system as a whole and ensure that there is equitable and sustainable prevention programming and work happening across the state. Each of those goals has a focus on prevention across all life stages, so youth through older Vermonters, as well as differences in culture and socioeconomic. So really an equitable focus in prevention across the board. Through those goals and in Act 82, they are tasked with the work of providing advice to the governor's office, the General Assembly, and the Department of Health on how to improve prevention policies and practices across the state, as well as ensuring that prevention is top of mind when making policy and other programmatic decisions. I also just wanted to highlight, as David mentioned, through Act 82, there were 2 positions that were created, the Chief Prevention Officer. So again, Monica Hutt. Through that language, it did explicitly state that the Chief Prevention Officer would be part of the council itself, as well as other tasks and duties outlined within that work. It also created my position. However, my position is slightly different in that I'm here to support the great work of the council, but I'm not an active member myself. I will pause there to see, David, first, if there was anything that I missed that I should notate, and then if not, I'm happy to answer any questions that you all may have.
I'll just note that the committee does submit reports to the legislature, and we
Thank
can
you.
send you links so the committee has access to them.
Absolutely. Thank you for reminding me of that, David. That is the primary way that they communicate with you all, is through that legislative report. There was one submitted for 2023, which we can provide the link for, and certainly can provide back reports if that would be helpful.
I think we have those,
Great.
posted for us. So as you're talking, it's deja vu. It's great to hear about that the council is in place and the executive committee is there. And I know that it's been a very difficult time since 2019 with COVID for any of the prevention work to take place. Obviously, it's very difficult to get into schools. Schools, many were closed, and it's difficult to get into the community. We've relied so much on our designated agencies and others to get some of that work done. And so I'm feeling very happy about this, simply because it took a couple of sessions to really formulate and to convince others that we should be consolidating boards, which we have done. But one of the boards I'm particularly interested in, and as a result of hearing that there's an increase in tobacco and vaping by kids right now, it's gotten to be, it's gone past the place where we were before the pandemic. So now, instead of seeing a drop, we're seeing an increase. So a couple of questions about that. Maybe you could help us understand first what exactly is happening on the ground now with the group is meeting, making recommendations, appropriating funds for what kind of activities, and in particular, what kind of activities for tobacco cessation for kids first, and then others. And then how is that funded? We need to hear that, because I know there's tobacco money coming in, and people still want to focus that money on tobacco cessation. But maybe you could talk a little bit about the programs, the work that you're doing, the activities that are going on.
Right, those are all great questions. So thank you for raising those points. The pandemic absolutely had a significant impact on substance use and work being done, though I will note that our partners were really wonderful and creative in figuring out ways to ensure that prevention was still happening, even though, you know, typical avenues may have looked a little different. So I just wanted to share that prevention work certainly has been going on. I can speak to what the council is doing in relation to those activities and providing advice, but I would certainly defer to David and others at the health department to talk a little more in detail about some of the points that you raised, Senator Lyons. The council absolutely is concerned about vaping in general and looking at the increased rates that we're seeing through our Youth Risk Behavior Survey, or YRBS, which is one of our core sources of information for our youth in Vermont and what behaviors or how they're interacting with substances to inform all of our programming work and policy decisions. Their focus has been to date really trying to get a good understanding of the landscape. Some of those same questions that you asked Senator Lyons are ones that our group is also exploring and looking at. Primarily, our council has broken out into 4 subcommittees. One is focused on policy, one is focused on prevention work and activities on the ground. One is focused on equity and another on communications. So each of those groups have taken a perspective around all substances at risk of misuse, including nicotine and tobacco products. So primarily they are looking at both legislation that may be coming forth related to nicotine and tobacco products, as well as looking at equitable prevention services across the state focused on tobacco and doing an assessment utilizing some of the inventory work that was part of Act 82 that we're happy to share the final report for that. And also providing guidance on messaging campaigns and really looking at vaping as a concept rather than specific substances such as cannabis or nicotine and tobacco, and how can we talk about, for the Vermont youth in particular, the risks of vaping no matter what the substance is. So a lot of their work has been really digging into what is happening on the ground and seeing where they may have an opportunity to provide advice to the Department of Health and others on how to make that stronger and more impactful across the board.
So in terms of, we don't have your report yet. We don't have a link to your report yet. So
Okay.
It should be coming in. I think if you can get, I don't know at what stage is the report at this point? Will we get it submitted?
Yes, it is final and I believe has been posted, but I can follow up to make sure that you have a
We
link.
just don't have it in our committee yet. So that's
Great.
I want to clarify that.
I don't see it.
Yeah, so then the other question I have, so the work that the group is doing is informing, has to be informing action somewhere. And
Yes.
how much money is available at this time for the Prevention Council? And do we have a printout? Will that be in the report of the funds available, and then how that's being used by the council, and then through DOH or public safety or other parts of government? And in particular, I'm going to focus a little bit on the tobacco and vaping, simply because it's like the pathway to other things in many cases. And then how is that being funded? What's going on there? I know there are other things I'm going to ask about. I would ask the same question about alcohol, and I would ask the same question about opioids and other drugs, but we'll start with tobacco. That's a concern that I know is out in the community, and I've heard a lot about it.
Absolutely.
So, I'll throw it back to you on that one.
Absolutely. So in the report, you will find information about state and special funds that are allocated to prevention. That will be in your first appendix of that report. It does provide a narrative on what those funds are used for. You will find 2 separate funds specifically allocated for tobacco and nicotine prevention, harm reduction, all focused on tobacco. Within that, I do just want to note that, again, that's general and special funds. So the Department of Health could certainly provide more information about any other funding streams that they have allocated for the work around nicotine and tobacco funds. I think where we are seeing the council currently engaging in conversations around funding is around the funds that were allocated last legislative session for prevention, supporting prevention coalitions, as well as the vaping funding that was allocated last session. So as the advisory council, they have been part of the stakeholder process for each of those funds to take their learnings and the information that they've been digging over the last few years to really understand the system of prevention and to provide guidance to the Department of Health for consideration on how to ensure that those funds are being best utilized to, again, strengthen the work of prevention. Certainly vaping and the vaping funding had a portion of that focus really on nicotine and tobacco products, but certainly thinking more comprehensively about prevention coalition and prevention work through that $3 million that were allocated last legislative session as well.
Okay, if I go out on the Department of Health webpage, will I be able to find the report? I'm trying to find it right now while you're on listening, but I'm not seeing it.
Yeah, we are current.
I don't see the Prevention Council, but that's another, that's okay.
Yeah, I couldn't find the website for it.
Yeah, so I guess what it would be great if you could send Alex a copy of the report so we could get it posted. I'm not sure why that hasn't connected yet. I'm sure that's happened somewhere along the way, but maybe not to Alex. That would be good, and then we can look at the appendices that have the specific allocations in there. Then and the reason that we kind of focus a little bit on, as well as other places, you brought up equity earlier, and
Yes.
the marketing campaign that's done that's inequitable by tobacco and vaping companies is of concern, but we'll probably get to that later in the session.
Absolutely.
Yeah.
And to that point, part of what our council is looking at is also ensuring that our counter marketing messaging, so our prevention messaging is equitable and is really reaching the folks that may be most impacted by other marketing techniques, and ensuring that those messages resonate with folks and really are reaching our target audiences to help increase those protective factors and information.
Terrific. Good. And then the other question that I have, then moving on to sort of the other drugs and opioids, how are you balancing the work that you're doing with the advisory group that's working with the opioid prescription drug money that we're getting? How are you intersecting there and ensuring that we're not seeing duplication?
Absolutely. That's a really great question. We are very lucky that Dr. Levine is chairing both of those committees and councils. And so we have broken out a portion of our SMPC meetings and subcommittee conversations to ensure that members are updated on the work of the other committee, and really taking a focus on amplifying, conversations if appropriate across the multiple committees, but really utilizing our executive committee to help drive the work of the SMPC, to not duplicate, but to help inform if and when that's appropriate.
Okay. All right. Senator Hardy has a question, and then I want to come back and while you're responding to her question, it would be helpful to know exactly what specific activities are happening now. And the other question I'm going to ask is about the youth risk behavior survey and when we might see that coming out.
Sure.
So I'll just put that to the side. And Senator Hardy.
I found the report, actually. It's on the
legislative reports page, but not on our page.
Okay.
So I just emailed it to everybody, including you, Alex.
Perfect.
Yeah.
So, thank you.
I got it, and I'll post it in a moment here.
Thanks. It came out January 1st, so it was under 2022 instead of 2023.
That's why we
So-
couldn't find.
I think that may be why it was confusing.
It was early. That's great.
Yeah, but there are recommendations in here, and I'm just scanning through them, and I was wondering if you wanted to highlight any that were ones that you were recommending for us to do work on. Is that possible?
Sure. I'll just go back to, and I know David will want to jump in as well, that I'm not an active member of the council. And so I am simply here to help share the great work that they've been doing. So I wouldn't want to speak for them. Certainly all of the recommendations were thoroughly vetted by the full council and voted on by the full council, but could certainly get more information if that would be useful for you. I don't know, David, hopefully I answered to that well, but if there's anything else you want to add.
You're well trained, I'm sure David programmed you.
David, did you want to speak to that?
Well, program is unkind. I would say. This isn't a Manchurian candidate thing. No, I think that's right. That it's important that the committee understand that these recommendations don't come from the department, but from the council. And if you want to speak with the council, we'd be happy to facilitate that conversation.
Okay, that's totally fair. Thank you.
Okay, we'll do that. Or we'll look at the recommendations and then make a decision about what we need to do. Any other questions from folks before we go to the sidebar?
I do. So all good work. My question though is, and just having 30 seconds to look over the report, I don't see metrics like effectiveness over time of programs, return on investment, something to tell our constituents that there's an impactful program, it's effective, it's creating, the right types of trends, or needs to be tweaked to increase the effectiveness. So I'm just wondering if you can comment on that.
Absolutely. So again, in thinking about the council itself and how it's developed, it's really there to provide and act as that advisory component. And so when they looked at the performance measures that they outlined within their report, it took a lot of time for them to discuss those pieces and what would be best representative of that work from their perspective and what they're putting forth. Part of what they talked about was that they have a very small role in a much larger system of prevention, though you will see that the measures that they put forth, and kind of going back to our conversation about the YRBS, are really focused on youth and young adult use of substances, and having that be one of the measures overall to see the impact of all of our systems of care, including prevention, on youth rate at a population level statewide. So they went through the entire report of YRBS and identified those that they thought could be most reflective of the work of prevention across the state.
But the department also maintains an extraordinarily robust dashboard by DSU and by tobacco efforts. So those are available. We could send you those links.
Thank you, David.
Does everyone know what YRBS is?
Go ahead, ask your question.
Does everyone know what YRBS is?
No.
Okay, so
Youth
that's
risk
important,
behavior survey.
but it's
Yes.
important to
Yeah,
give a little more info on that.
yeah, that's why I asked. Okay, we'll take Terry or Senator Williams, sorry.
Guys, you're doing good work, but our constituents if you open up their local paper, you're seeing the number of people that died from opioid. They don't tell you that, but in reality, if you see a 27-year-old that passed away at home, they're wondering why we're spending all this money at our level, and it's not getting, the prevention isn't getting to the people that are actually using the stuff. So when I hear prevention, I expect to hear, boots on the ground. What are we doing to cut off the head of the serpent and prevent this stuff from getting to them, number one. They've got it, okay, I get it, they're addicted to it, but what are we doing to make sure that they don't get out of treatment, and they go right back to the same dealer and the same place? We have to explain this to our people, and I'm not seeing the justification for spending the money and creating the positions that we are, because it's not getting to the user.
Senator, I think it's a critical issue, and I think it'd be great to have folks from DSU come in and talk about our efforts and the things that we are doing and that need to happen. But that's really distinct from the Prevention Council, which is really focusing on upstream efforts. But we'd be happy to come back, and we need to talk about this.
That's good.
Okay.
Go ahead.
No, it just, when you've had a family member that was addicted to opioids and it wasn't his fault because he was being overprescribed. And that was a while ago, and I know there's been a lot of steps taken between now and then, but still happening, except they're not getting it through their doctors anymore. And I'm looking for some results because I got to answer to the people that elected me to this position.
Here, here, Senator. Thank you.
So that was my sidebar question. Now, what's happening on the ground? What are the activities going on? And David, you're suggesting that we have another opportunity to hear from whom?
I think it makes sense that we could bring in Kelly Doherty, and we could bring in some other folks from DSU who are directly involved in the work.
Okay, we'll do that. Okay, and then the other question, before I ask my other question, we'll have Kelly Doherty in. This is good. Senator Gulick.
Well, I just want to piggyback on what Senator Williams said, which is, and I think I heard you saying this, and I've heard it from my constituents too. It's a need for a beds, a need for a place for folks to go and stay while they're in recovery and beyond, because they get released and they go right back to. Anyway, I don't know what's happening in that arena, but that seems like a huge gap.
Yeah.
Yeah, we have a lot of ground to cover.
And if I may, Madam Chair, these are vital questions, and I think that having beyond Kelly Doherty in, because no offense, David, but the Department of Health is not the ones that are the boots on the ground. And we need to be hearing from people at the local level, and there are many in both of your districts who are doing this really tough work and are not getting the support and resources they need. And I will have a couple bills, and I will ask you to just co-sponsor them, because I think we need to be doing more in this area. And there's a lot of great work happening at the local level, but it's not getting the support it needs.
So we'll have we just spread out into our DAs, we just spread out into our mental health, Department of Mental Health and other areas where we will get there. There's a lot, and there's a lot going on. There's also Department of Mental Health has sent out some RFPs to link people with community resources. We have peer support to look at. So there is a lot going on. I don't know, will Kelly Doherty be able to, because the Prevention Council was intended to be cross-departmental and cross-agency, will she be able to come in and talk about all the work that's going on within AOE, Department of Mental Health, Public Safety, that relate to prevention at different levels? Can she do that?
I would, Senator, if you ask us to present on, we can assemble the people you need to hear from.
Good. I mean, you just heard the question, so you
Yes.
just heard the concern.
Yep.
I think from every member of the committee. So if we could have you communicate with Alex, and we can get some folks in, and we'll also communicate with others who are out in the community and get their perspective. So that would be great. Yeah, the whole boots on the ground is critical, as Senator Williams has indicated. Great. So then the other question, any other questions while we're here in that area? Yeah, we could comment a lot. So on the Youth Risk Behavior Survey, which is YRBS, can you tell us what that is and what it will include and when we might see the latest report?
Sure, absolutely. So as I said, YRBS is one of our core sources of data and information that we utilize for all portions of our system of care, but especially prevention. It is a survey, as the title says, to understand different behaviors that youth in Vermont are engaging within. Though I will note that it's actually a survey that is done by the CDC that Vermont partners with for implementation. So this is done, I believe.
What does that acronym stand for?
CDC, the Centers of Disease Control. So our federal partners help to develop the survey, and then Vermont and the Department of Health, as well as our colleagues at the Agency of Education, work to actually implement the survey. So we do that through our school system, which allows for us to have really wonderful representation of our entire, youth and school-aged populations. The survey is put forth in middle school and high school. And our reports do break out that data to talk about both middle school and high school, as well as comprehensive data across all ages. We had been able to implement that survey even during the pandemic, and that's the data that we are waiting on. So we are at a point where we are waiting for data to come from CDC back to the Department of Health for us to be able to generate our reports and responses to that. I haven't received a recent update on what that timeline looks like. David, I'm not sure if you have, but we can certainly touch base with folks and give you a ballpark sense of when we're expecting the data from CDC, and then when we'll be able to provide reports to inform the great work you all are doing.
So we'll get some data on rates of suicide, we'll get data on substance use disorder and use. What other kinds of things will we see?
Yeah, the survey is really comprehensive. So as you mentioned, certainly mental health measures, substance use measures. There's also components that talk about driving and seatbelt usage. So it's really comprehensive, which is why it's such an important report and set of data that we have. There are measures that can be broken down even further beyond those very broad topics. One of the pieces that you mentioned earlier around vaping, there is a special report on our webpage from the most recent data that we have available that looks at the shift in vaping for our youth in Vermont from previous years to our most recent. That could be useful in thinking about prevention and what that is looking like.
Okay. Other questions for Nicole or for David? This is the bare bones introduction. There's so much embedded in what you're talking about, and we get it, we know, and there's a little frustration you're hearing on the committee, because this committee in particular has been working on the mental health issues and the substance use disorder issues, and our hope is that the Prevention Council will make some robust decisions that will prevent tobacco, the nicotine addiction or opioid addiction. So this is our first crack at that. So you all will be back in, and I look forward to having you send a list of folks who can inform us further about what exactly is happening and how each of these different areas is funded. So, and how it overlaps or does not overlap with some of the prescription drug stuff that we're getting. There's a lot there. And that, yeah, so there's a lot there. We'll leave it at that for now. And I know that the Department of Mental Health has its own set of RFPs going out that's gonna include mobile crisis across the state. That there's a lot of work going on, but we need to understand what is going on and where the gaps exist so that we can make some qualified decisions when we make recommendations to appropriations or when we pass policy. So I really thank you for your time. Any last questions? Do you want to say anything further, Nicole or David?
I just want to thank you on behalf of the department for the energy and the interest that you bring to these, extraordinarily important subjects.
Well, we want to go as far upstream as we can get. And part of that is, let's limit the number of times people have to go through recovery. And we're planning on a couple of field trips that might help us with some of this as well. Anything else, Nicole? You want a final word?
I just want to second that thanks. I see what I saw today with you all, and the important questions that you're asking is certainly pieces of what this council has grappled with. So as I said, we're a small part of a very comprehensive network of work that's happening across the state and certainly closer to the ground. So thank you for your interest and thank you for your questions today. And I look forward to answering any further questions that you may have later on, and appreciate the work that you all are doing.
Okay, well, thank you. And we all are going to take a quick break. And so Alex will go offline.